A new report from a group of MPs says that people with eating disorders are being failed. They're warning of widespread neglect within struggling services. It's an all-party parliamentary group saying that eating disorders are one of the largest treatment gaps in healthcare and saying that eating disorders have been overlooked, underfunded for way too long, and lives are being lost because of what they have called inadequate care. Well, Paula Blight is CEO of SWEDA, which is the Somerset and Wessex Eating Disorders Association. Morning, Paula. You were in London for the launch of this report yesterday. What did you make of it?
Yeah, morning, Vicky. Well, it was a very exciting day, really, to go up to London and obviously visit the Houses of Parliament. But obviously very special because of, this launch of this project, with the APPG. I think, we were very well represented from the Southwest. Obviously, SWEDA was there. We're now South and West Eating Disorders Association. We've moved to a wider area rather than Somerset. Also, Vera Hobhouse was there, and she's the MP for Bath. So she chairs the APPG, and obviously Hope Virgo, who's a Bristol girl, she brought all this about as she's now running the secretariat for the APPG. So we were very well represented from the Southwest in London yesterday, which was very exciting. Yes, yeah.
It really sounds it. I mean, the figures show that there is a rise in cases of anorexia and bulimia over the last decade. Is that what you're saying? Does it can't alarm you because you must know it?
Absolutely. For those of you, who've known SWEDA, because SWEDA's been going now 30 years. We started in Somerset, as I said to you before, and we have really battled, with trying to get funding, trying to work with the demand. And although I can say, we're reasonably well served in Somerset, I think, what the NHS have done, how they work with the voluntary sector, which is SWEDA, I think has been brilliant over the years. But I think when you're looking at the increase we're all experiencing within the eating disorders service, it's just massive. I mean, last year alone, we had a 32% increase. And next year, we'll probably get another 20 to 30% increase. So, I'm asking, how do we manage that demand? And that is our biggest problem, I think. So, that's why this paper and this report has been done, so that it is recognised, because the long-term plan is coming out for the NHS, obviously going to be launched in the spring, and we're really interested into what does that mean for eating disorders? Obviously, we're asking for 5 things on the report, so hopefully some of those things will come through and will be better off for people with eating disorders. I mean, we've been neglected for decades. So hopefully this will be for the people who are suffering from eating disorders.
A 32% increase is phenomenal.
Yeah.
Phenomenal. What is driving that?
I think the pandemic has hugely driven that. I mean, we've seen masses of growth in the pandemic. I think it's a mixture of things. I mean, we are more acceptable to mental health. We're obviously a mental health charity as well. I think people are recognizing it more. People are aware of the condition, so people are coming forward. Also, we're looking with younger people. We believe, although we have an all adult service, from 4 right the way up to their 80s, people who are in their, 50s, 60s and 70s have had eating disorders maybe for decades, 20, 30 years. But once it's entrenched, it's very difficult to work around. So we're working more towards the younger age group. We've certainly developed our children's service over the past couple of years because we know working with the younger people, we can work with them for less amount of time and move them on to recovery a lot quicker. So obviously it's more cost effective and hopefully they haven't got decades of having an eating disorder ahead of them. And we know that if you can get young people, so, certainly across Somerset, we're in all the colleges working with the 16 to 18-year-olds, which is a key group for, the prevalence of eating disorders. So, we're in Yeovil, we're in Taunton College, Bridgewater College, and Strode College. We've just completed the Fresh Affairs in the autumn. And it's just really important to get what we're doing out to those young people, so that the sooner we can see them, the better.
When you're working your socks off and then you sit in front of a group of MPs who say that people with eating disorders are being failed and that there's widespread neglect, obviously it's great to shine the light on it. Is there a little bit of you rankles at thinking, we're working so hard, but we just can't reach anyone?
Yeah, I think it rankles me when we see the increases, year on year for eating disorders, yet we still get the same amount of funding. That really rankles with me. But then, the feedback that I get, but we're all, working with higher demand. How do we, differentiate between eating disorders and other conditions? And I can see that, but I don't think there has been a fairness with eating disorders and with the condition. And I think if we were to put everything back in the pot and rejumble things and say, okay, what condition, is this and this, I think they'll find, and which is why this launch has been done, eating disorders are massive. And people are not registering that. And we just want a restart, really, and say, this is, eating disorders definitely need more money, and additional funding. Like I said, we are, well served, I would say, in Somerset, and other parts of the West Country. But there are areas that have got, complete black holes, where people can't get into an eating disorder service unless they have to go into emergency care. And that doesn't help anyone. We want preventative work. We want that early years work, so that people don't have entrenched eating disorders later in life. And I'm hoping that with the NHS 10-year plan, they are looking for more preventative work, which is where the voluntary sector sits. If we can do the early years work, then hopefully the NHS don't have to have massive budgets for emergency care and emergency admissions and even hospital admissions. If you can work with people in the community, they shouldn't get to that desperate state where they're being refed in hospital units. So that's what we want to do. But it takes, a different mindset to invest in that preventative work. But I'm hoping, we work with the King's Fund, and I often go up to the King's Fund in London. And that is the big thing now. And so we're hoping as a charity and as a Somerset-based charity that we can be involved in some of this work, and some of our evidence-based that we're proving is really effectual. So I'm hoping that we can lead on some of this work. But there are some interesting things also within this report about having a non-executive director specifically for eating disorders, sitting on NHS trusts, and I would welcome that across the West Country. So the NHS trusts out there, if you're looking for experts of eating disorders, actually sitting on the non-exec boards, we have plenty of people in SWEDA who could do that and who could be that independent overview on what's happening with the services. So I think, some of the things that they're offering, such as training for healthcare staff, I think is really interesting. We've done pieces of work over the years training Somerset GPs, which has been really, really interesting piece of work, but it needs funding.
Yeah.
So,
you're talking about the training. Frontline workers, some of these recommendations, training for frontline workers, including GPs and teachers. Does that do you risk then teachers being overwhelmed because it's just too much? Or is this just they recognise the sign and then they know to point in the right direction? Is that more so rather than being there to do the hard work themselves?
Absolutely. I mean, we do a lot of this type of work, which, is categorized as the low level work. I mean, we've been across all the colleges in Somerset, and we've worked with the support staff. We've worked with, the tutors. We've gone in and done sessions within tutor group sessions, just so that they know the basics. They know the understanding. How do I help a friend who's got an eating disorder? We give them the basics so that they can actually recognize it. And then if they want further help, they know that they can come to us. We've done some work with school nurses, and we've got them together and we've done a piece of work with that. Like I said, we've done the GP training. We've actually worked in some of the private schools as well in Somerset, because we know that there's a lot of private schools in Somerset, and they've invited us in, and we've done some work there as well. So yeah, it's actually genning yourself up, I think, as institutions, just so that you've got that basic awareness. And we're skilled in that area, and we can do that piece of work, and we'd be happy to do that piece of work.
Paula, how can people find out more about you, SWEDA, Southwest Eating Disorders Association, and get some help and advice if they need it?
Yeah, we've got our website, which obviously gets a lot of hits. So I think that's the best way. You can either put in Eating Disorder Somerset into Google and it comes up, but our website is swedauk.org. Contact us. If you want to refer somebody or you want to self-refer, that's all there on the website, or you just want some information. Again, all that information's there. So yeah, we're here to help.
Thank you so much for your time this morning. Paula Blight, CEO of SWEDA there, the South and West Eating Disorders Association.